So here comes one of the best bits. I think the most exciting bit of doing EASD TV is meeting the rising stars every year. So we have this year's 4 rising stars. I'm going to introduce them to you. Well, I'm going to make them introduce themselves, but I want you to mark their names. I want you to concentrate hard on their faces, because these are the people who really will be the stellar stars of the future. So no pressure, folks. So let me ask each of you to introduce yourselves. Let's start with you.
Hello, my name is Sindre Lee-Ødegård, and I'm a Norwegian medical doctor and researcher.
Hello, my name is Martin Schön. I come originally from Bratislava, Slovakia, and I work at the German Diabetes Center in Düsseldorf in Germany.
Hello, my name is Cadenas-Sánchez. I'm from Spain, Malaga, and I'm working currently at the University of Granada in Spain.
And my name is Jens Lund, and I'm a postdoctoral fellow at the Novo Nordisk Foundation Center for Basic Metabolic Research in Copenhagen, Denmark.
Okay, so first of all, how surprised were you to be awarded this Rising Star Award?
I think it's only now that I sort of realized or got surprised, because I was working when I got a call about the award, so I was a bit stressed, and but sort of now I think now it has sort of settled in.
Yeah, I think that the same feeling that I had. I think that when you go to the place, you realize that you got it, and I was really, really amazed and grateful as well for the team, for everyone who made this achievement. It's not only for me, but yeah, I keep remembering the day when I opened the email and I read it, and I said I got it.
So you didn't think it's a hoax?
Yeah, I had to double check as well. I was very surprised. Because I know that many people had to apply for the award, and we might have been very lucky to be those who were selected. Maybe the areas of research that we do were attractive, for we are touching the hot topics, but it's always a combination of luck and to maybe send the application in the right time. So I'm also very grateful and very humble to get this award.
Just can I make absolutely clear to them all, it's not luck. It's quality and talent. Sindre?
I was also very surprised and very happy. And also, I feel it's not only my work, of course, it's also my colleagues and everybody I've worked with. So I think it was an honor to all of us. And also, I think it's very good, because now it's the first time that Norway is on the map.
Great. It's good to have Norwegians here. So, Sindre, tell me, what's your area of research? And what should we look out for from you in the future?
You should look out for better exercise as medicine, because I have actually a background as an exercise physiologist. I started out with an interest for sports and nutrition when I was a small boy. And I just went on doing my bachelor's on this, and then I just loved physiology. And we were 7 finishing the bachelor, and everybody went to medical school. And there I did a combined MD PhD track, where I continued doing research on exercise and pre-diabetes. And then I did a postdoc during my residency. And then I got a research position now that I'm combining with the endocrinologist training. So we are focusing on high-risk groups in Norway. Women with gestational diabetes, and also South Asians, because they have a very high risk for type 2 diabetes. So I want to prescribe exercise as a medicine for those.
Very good. And are you very keen on sports?
I was. I did a lot of sports, but now I have 3 small children at home. And what I can manage now is I'm biking every day back and forth to my work. A whole year, but that's basically what I can do.
Another kind of sports, I would say.
Now, you are also, Martin, in sports physiology, is that right?
I also did my PhD in exercise physiology, and to be honest, the title of my PhD defense was Exercise as a Medicine. But now,
so great minds think alike.
Exactly. But now I'm doing postdoc in Germany, in the German Diabetes Center, and I'm more focused on diabetes, on the precision diabetes diagnosis. So to break down the heterogeneity, especially of type 2 diabetes, that would allow us, based on the phenotype, to tailor, hopefully in the future, not only the pharmacological treatments, but hopefully also the management when it comes to exercise recommendations or maybe diet recommendations for specific groups or specific individuals with diabetes. And I have also still interest in intervention studies, especially when it comes to lifestyle. We are doing one intermittent fasting study right now that we applied in high-risk subgroups of diabetes, and we want to see if it brings any difference, any change, which would maybe create the basis for tailored lifestyle interventions in specific groups of people with diabetes.
Christina?
Yeah, my background is also the same as them. It's I did my bachelor in sports science, and
Which kind of tells you that this is a hot area at the moment, doesn't it?
Yeah, exercise is medicine, as it says, and every move counts, as I always say it and promote. But yeah, I did my bachelor in sports science, and then since then I thought that it was really nice always to look at physical activity and its relation with health. But instead of looking at elderly or adults, I look at childhood obesity. So my thesis was focused on academic achievement, brain health, exercise, and in children with overweight or obesity. Right now, I'm moving to more epidemiological data and looking at how physical activity or how fit you are can be a good predictor of health from preschool children, 3 to 5 years old, till adolescence and adulthood.
Fantastic. Now, Jens, you are the odd one out here, aren't you?
I guess so.
Because you're not into sports physiology, but tell us what your area is.
Yeah, so my background is in biochemistry and human biology, but I also work partly related to exercise. So my PhD was about a molecule called lactate. And this molecule builds up when you do anaerobic or high intense exercise.
So it's the reason that you get those kind of burning pain in your legs.
Yeah, at least many people think that's the reason. And it is also a signaling molecule, so it's acting like a hormone. So we've been studying lactate as a hormone-like substance. And then we found that actually, when you treat mice with exogenous lactate, they lose weight and they lose their appetite, and people have usually said that is beneficial effects because it sort of counteracts obesity. But we've realized that it's the weight loss and the loss in appetite is because the lactate injections are causing sickness in the mice. So the injections are severely hypertonic, and that likely destroys the tissue where you inject the lactate. So yeah, my research has sort of uncovered, or our research have uncovered a sort of a major methodological problem in the study of signaling metabolites.
Interesting, and it's funny, isn't it? Because some of the newer therapies, in some ways, they're almost a bit like giving you a dose of the flu or something like that. You don't eat because your gut transit time is slowed, isn't it? And all those things that you experience when you're hungover or not well, and you just don't want to eat anything, are similar. And that's a kind of effect in lactate, is it? That it's making us feel ill.
Yeah, so exactly, it's the same. The loss of appetite can also be a signal of illness. Yeah.
So interesting. So you are now part of a fellowship. I mean, not only with all the rising stars of before, but all the four of you are now going to be bound together to go through your academic life together. And actually, that's really important, I guess, to have people at a similar stage who share some of the kind of worries that you have, because it's not all just about the academic research, is it? Because as you need to get on, it's about how you work-life balance. It's how do you manage your team? It's how do you get your papers done? How do you get your grants done? How do you deal with the really difficult professors? Not that there are any difficult professors out there, of course, but how do you deal with all that? So is that kind of fellowship, do you think, going to help your careers, Christina?
Well, I think that you summarized really well our life. It can be even more summarized if you say, I always say that it's a matter of resilience. It's everything. I mean, everything it's now, it's really cool because we got the recent awards. We are recent stars, and we are really grateful for that. But at the same time, we have been walking this path for a long time and jumping some rocks, as we usually say, like many challenges. Also moving abroad. I've been out of 2 years before coming back to Europe. I was in Stanford University, and just in January I just
You got out just in time.
I got back just in time. Yeah, exactly. So the life of the researcher is amazing, but at the same time we need to work harder to get these kind of awards. And not everyone got it, but when you get it, it's when you finish a race. And
it is, as I said before, highly competitive.
Exactly.
And it's not luck. You might tell yourself that you were lucky. No, you were not. You were very talented, and that's where you rose to the top. What do you think you will be doing, all of you, in 10 years' time? What would be your dream? Let's start with you, Jens.
Oh, tough question. For me, right now, I think the plan is to try and get a starting grant, but that's, I guess, even more competitive maybe than getting some of the prestigious Young Career awards. Yeah.
I have no idea. I mean, in 10 years, I think that I wish to be probably in this conference and in others, still promoting and discovering new things, trying to keep my motivation and for working and helping people, especially kids.
Translation is obviously very important to you.
Yeah.
You know, actually getting it out there. How about you two?
Maybe professionally, I think in 10 years we have good chances that we would be able to more tailor the management of diabetes to our patients. So I would like to complete my training in endocrinology and diabetology, and hopefully in 10 years I would like to imagine myself to be in an outpatient clinic with a patient with diabetes and to be able to tell him or her from what kind of treatment is he or her going to benefit the most, from what kind of exercise, from what kind of diet. And it's my dream and ambition to be able to contribute to this research.
Yes, I know exactly where I am in 10 years. I have finished my endocrinologist training, and I have become a professor, and also gotten through my first 3 PhDs, and my group is expanding and doing really well, and my children are healthy, and my wife is still happy.
So that's a pretty long list, wish list there. Listen, you've done fantastically well. You should be really proud of yourselves. And I hope that you're now going to go to your CVs, put it in really big letters, Rising Star EASD 2025, because it does mean something. It really does. But as I said, it also enters you into a fellowship, not just of this year's winners, but actually the past year's winners. And actually, it's that fellowship that's going to help you get through some of the tough times that you are bound to experience during your academic research careers. Congratulations. Fantastic. And thank you so much for coming into the studio to talk to us. So
Thank you very much.
There they were, the rising stars. Hope you made a note of their names. You'll be hearing much more of them in the future. And from me too.